remember being so very excited about the sort of technology that was available through LASIK. But what I was really most excited about was how life-changing the experience was for these patients. Once a patient reaches out and makes their LASIK evaluation appointment, the first thing we do is we perform some testing. We do corneal mapping, we look at the size of the patient's pupil, we look at the corneal thickness. These things are very important because ultimately, safety is number one. Once I determine that you're a good candidate for LASIK, then I'd like to always cover what the experience will be like in our LASIK suite. The patient spends about 10 minutes of their time in the LASIK suite with me, although the procedure itself takes less than a minute per eye. Once you come into the LASIK suite, we'll make sure you're relaxed. So we give you a little pill to help you take the edge off. The first thing we do is we numb the eyes using eye drops. There's 2 steps. The first step is that we use a device called a femtosecond laser. Instantly after that step, we swing the bed over underneath our excimer laser. The patient during this step is simply looking at a blinking orange light. Once we finish the excimer laser portion of the procedure, I help the patient up off the bed, and instantly the patient can see a difference in their vision, which is very exciting for the patient, my staff, and myself. Once the procedure is finished, I will examine the patient's eyes to make sure everything looks exactly as expected. Prior to the patient's departure, we'll make sure there'll be an appointment for the patient to return in 1 week. Over the next year, we have the patient return once, maybe twice, just to make sure the outcome is exactly what we expect and what the patient wanted. During this process that patients tell me their stories, they say things like, "It's just the little things, doctor." That's the best part of all this. It's just hearing patients tell me how it's truly changed their lives.